All right, I'm here with Sabina today, and again, we want to demonstrate NIS in action, what it actually looks like in practice. So I'm going to ask Sabina just to tell her story of kind of what has happened to date. I mean, you don't mind doing that?
No, I don't mind doing that. I had headaches that started about 4 years ago, and they thought they were migraine headaches. I went to neurologist, I had an MRI, I had all kinds of medications, I tried meditation, I divorced my husband, I did everything I could to get rid of these headaches. And what worked 4 years ago was Botox injections all around my head, but they came back a couple years ago. And I was telling Wendy, your office worker, about my headaches, and she said, oh, come to NIS. And so I came, and I haven't had a headache in about 4 months, and I am thrilled because they were every day.
That's wonderful.
Yes, it is.
Now, you were saying something about the left side. Tell me about that.
Oh, yes. I noticed that I was getting leathery patches on my face and eyebrow and down into my neck, but only on the left side of my body. And I would like those to be gone, please.
Okay, so she's had great success with NIS today.
Yes.
And we want to see if we can just dig a little deeper and see what's going on with her. So I'm just going to look at your neck here, Sabina, and yeah, there's a distinct difference between the left, and there's a lot more tension in the muscles on the left side than the right. Can you feel that? You can.
Yes, I can. When you touch it, I can.
Yeah. I mean, she says it doesn't hurt her, but there's a distinct difference there. So I would start a little differently than I do with some patients, and I just want to see if there's any difference for her neurologically between the right and left side. So if you could stand up for me.
Okay.
I'm going to ask you to bring this arm up, the left arm up. We're just going to get again, hold. And again, I'm not pushing that hard, am I?
No.
No, we're just looking for the muscle control. It has nothing to do with strength. So I'm going to ask you to put your foot forward on the right side. And she is totally solid with that. We're going to switch arms and put your foot forward on the left side now and see what, and there she's got no strength. Now if you put your foot back, and again I want to make sure I'm checking her in the neutral position, she's got total control. When she activates this gait mechanism by putting her left foot forward, her nervous system is saying there's something interfering with that pattern, with my ability to have a normal gait pattern. So we're going to investigate a little deeper on that. Put your foot forward for me.
The left one?
Yeah, please. And we're going to check some neurological points here and see what happens. So I'm just contacting different points. Hold. Now, we found a point on the back of her skull here that strengthens her. You can feel the difference there, yeah? Yeah, so she goes right into strength there. You can put your foot back. So this is interesting. This point is a point associated with the pons, which is the upper brain stem. And that seems to reestablish normal neurological control with the gait. So let's look at this. Do you have sometimes a feeling of imbalance?
Yes, I do.
Yeah, so sometimes she feels off balance. We got to remember that the pons is where the nuclei for some of the cranial nerves are located, specifically cranial nerve 4, 5, 6, 7, and 8. So the 8th cranial nerve, of course, is that vestibular auditory nerve. So it's hearing and balance. So if you don't mind, I'm going to ask you we're going to stress that system a little bit. So turn your head rapidly side to side, which stresses that vestibular, and she can't hold that. Cranial nerve 4 may or may not be involved here, but if we have her look up and to the left, this is the trochlear nerve. No, she can't do that either. Cranial nerve 5 would be the trigeminal nerve, right? Which is the, yeah, so there is some, I'm curious if it's the right side or the left side. Yeah.
The left side.
Left side, yeah. So very interesting correlation that we're seeing here with Sabina. So cranial nerve 7 is the facial nerve. So if we have you just squint your left eye, just that would fire off that 7th cranial. Yeah, they're all involved. Squint the other side for me. And she's fine there, as you can see. No problem. It doesn't shut her system down. So very interesting correlation that we're finding here. So let's see if we can find out why that pons is interfering with these signals between the brain and the body. So I'll have you, if you wouldn't mind, just touch here. And I'll use your other arm and just hold. No. You take your hand off of there. We're going to do this. Hold. Yes. Okay. So let's go up here. I'm just going to do a quick test here. I'm going to go right here and have you hold. Now, I'm going to ask you, have you had any types of head trauma?
Yes.
Whiplash injuries or concussions, things like that?
I was hit on the head with a croquet mallet, like boom, when I was a kid.
Ouch.
Yes.
Yeah. Okay. Yeah. Here's why I asked this, because the test that we did indicates that there's been at some point in time for her some actual trauma to the brain. So these would be anything that, of course, causes the brain to bounce around inside the skull. Okay. And it does indicate that something like that has happened. And if we go here and we check, it's interfering with the right motor cortex there. We go up to the left motor cortex, strength. Now, I'm going to have you touch right here, Sabina, on the motor cortex on that side.
Okay.
And we're going to go over, use the other arm. And there. Now, I'm going to add the pons reflex back into the mix here. You ready? And hold. See how strong that gets? Yes.
Yeah.
So the brain has just given us a whole bunch of data that correlates very nicely with what we're seeing when we test her physically. That signals from the right side of the brain here are getting short-circuited at the pons, and all those nerve pathways, they come down through the midbrain, then the pons and the medulla into the spinal cord. So it's just like, you know, it's like the interstate of nerve traffic in there, and there you've got a little roadblock in the pons here. So that's what we want to work on here. So again, if you could touch here over a little bit, so you're on the motor cortex. I'm going to hold the reflex for the pons here, and we're just going to integrate that. Now, let's see if we've accomplished what we had hoped here. So I'm going to go like this, hold, and then if you wouldn't mind, put that foot forward on the left side again.
Okay.
And hold. And you can see how much stronger that is immediately. Yeah. Now bring your foot back, and this time I want you just to do that shake of the head again. Doesn't weaken you anymore.
No.
Yeah. And now look up here.
Yes.
There. Squint that left eye again. Good. And then we'll just stimulate that 5th cranial nerve on that side. Now I have no idea if this is going to affect the skin on this side or not. We'll just have to watch, see.
Okay. My fingers are crossed.
Yeah. Well, let me know.
Okay.
Or let Dr. Shelley know.
Yes.
If that makes a difference for you. But that's another very nice demonstration of how neurologically based this work is, and how when we can get all the neurology, any interference in the neurology removed, which the brain does for us once it understands where the points of interference are, how profound the effects are. Now, it's a simple correction, but the cascade of neurological events that triggers is infinitely complex. But the brain does it very quickly, as you can see.
Yes.
Yeah? Good. Thank you so much.
Mm-hmm.